If you know of anybody suffering from psoriasis or you yourself suffer from psoriasis, you are going to love this episode today. I'm going to be talking to Dr. Nitin Deshmukh, and we're going to be talking about the homeopathic approach to psoriasis, which actually is life-changing for sufferers. This is something that you don't want to miss. Hello, welcome. Thank you so much for joining us. And I'm really pleased to be able to welcome back Dr. Nitin Deshmukh. It's lovely to see you, Dr. Nitin. How are you?
I'm doing good, Mary. How are you?
I'm good, thank you. Now,
Thank you
I
for
know that you run Homeopathy in India, and you've been a doctor and a homeopath for quite some years. Is that right?
Yeah, I'm practicing from last 20 odd years. Yeah.
Okay. So, and I know that you have a lot of experience in India because a lot more people use homeopathy, don't they?
Mm. Homeopathy is a very popular and the second best method of treatment here. So we
Okay.
have the mainstream medicine.
Yeah, and you have homeopathy in the hospitals, and you really everybody knows what it is. It's quite amazing because it means that you're seeing a lot of people. And I'm excited because you've come today to talk to us about psoriasis. And psoriasis is usually very, very difficult. But you have a lot of experience in this area.
Yeah. It is very common here in India. We get a lot of cases of psoriasis. It's a very common disease, though it's an autoimmune condition, but it's a commonly seen cases here.
Okay, tell me why. Why is it so? Why is there so much psoriasis around? Why do you have a lot in India, and why are we experiencing a lot in the Western world as well?
Uh, See, there are different concepts of understanding psoriasis. So, clinically, psoriasis is an chronic inflammatory skin condition that leaves your skin red, inflamed, with the scales and flakes. Right. So, the skin layer maturity level, where the skin usually grows within 4 weeks. So it is exaggerated. It is triggered for a quicker maturation. So the upper layer of skin gets matured frequently, and then that forms scales and flakes. So this is how psoriasis develops. There are a lot of conditions which triggers psoriasis. Maybe the change of climate, change of place, but majorly the trigger factors are emotional stress, the any mental trauma. So this is quite commonly seen affecting the cases of psoriasis, because what we have seen in our practice that the triggers are usually the mental issues or the emotional issues in the families of the patient, and that is something which is triggering them.
So what
So
you're
that
saying is psoriasis is often caused by stress or trauma within the family.
true. So along with the other issues, other trigger factors, the stress and family issues is the prime important thing to be addressed in cases of psoriasis.
Okay, that's really interesting. Can you just start us off by explaining what would usually happen in mainstream medicine with psoriasis and why is homeopathy different?
Okay. See, mainstream medicine tries to control the symptoms of the cases or the symptoms of the patients.
Mm,
So, if I develop a lot of itching, burning, scaling, flaking over the skin, there is a lot of inflammation. So, they will be prescribing me all the anti-inflammatories, the anti-allergics, so anti-irritants, and they will try to soothe my skin. So, they are correct at their own part. So, there is
okay.
nothing wrong with it. But
No.
whenever we are going with some acute exacerbation of the symptoms, it is important to be prescribed on the acute symptoms. So conventional medicines are doing their own perfect part so to make the patient better. So they are okay with their practice. And homeopathically, if we consider, so we consider as that psoriasis is not only a skin disease, but it is an external manifestation of the internal derangement of the body. So that is how we term it.
Okay, so let's say that again for me. Psoriasis is
External manifestation
uh
of the internally deranged body.
internally deranged body. So,
Right.
so Okay, so what's going on? What is internally
I'll say,
deranged in the body?
yeah, I'll simplify it. So psoriasis is an autoimmune condition. So your autoimmunity develops the disease. So when the immunity itself gets suppressed, so
Mhm.
your own immunity is getting suppressed and it is developing the disease for your own body. So this is something unusual. It is not commonly seen because usually what we have seen is we are getting affected by external things and then we get suffer, right?
Yes, yes,
But in autoimmune cases, your own body tries to develop a disease in the own body.
is creating it.
So now your immunity is depleted
Uh-huh.
because of the internal factors.
Okay.
So here the psychodynamics plays a role. So homeopathically, when the psychodynamics we understand, so skin is what? Skin is something which is protecting the whole body.
Yes.
So when our protection is being deranged, it is being diseased. So there the disease starts from the skin, right? So see, I'll just simplify it. What do you call it? The skin diseases are usually developed because of suppression of the immunity. They are the outcome of the emotional trauma, stress that cannot be expressed by other means. So skin,
Okay, okay. So let me just make sure we've got this then. So what we're saying is emotional trauma is going to cause a lack of immunity. It's going to cause the immunity system not to work as well. And then the body gets confused and starts producing or making a problem, which is seen in the skin, which is usually there to protect people.
correct, very correct.
Okay, so so what do we do about it? What can we do? How can we help?
Yeah. So we need to treat the root cause of the disease. So not merely prescribing something on the surface, we need to treat something from inside out. So here the Hering's law comes into play. So we need to treat the symptoms from inside out. The homeopathic principle is what? That we need to take the whole case taking of the patient. We need to understand the individuality of the patient. We need to understand the physical, mental, and emotional makeup of the body. And then we need to correlate all those symptoms altogether, mentioning the elements, mentioning the trigger factors, mentioning the stress issues, and we need to find a simillimum which is comprising of everything that patient tells us and we observe. And this is
Okay,
how that curative medicine, that constitutional medicine is the treatment for psoriasis.
and are do people know what the trauma is generally? Do they know what is the conflict? Is
Uh,
that something that they are consciously aware of, or is that something that comes out over time?
yeah, see, psoriasis being an autoimmune disease, it doesn't come overnight. So it is there, it is developing there in the for months and years inside the beneath the skin.
Mm,
Usually they are not able to correlate with the stress issues or the emotional conflicts or the mental issues. So we need to dig into their case taking to find out what has triggered what.
okay. Okay, so we're really going to be delving deeply into what has happened from conception, perhaps even inherited. Was there any case of this in previous generations? Will they have sometimes come in with an inherited predisposition
Yeah,
for
it's commonly
psoriasis?
seen.
Uh-huh.
It is
Okay.
also,
Yeah. So there are many different things that it could be, and it is our job really to act as a detective and work out what was the cause of it. And then what we do? What can homeopathy do once we know what that cause is?
so once we prescribe a constitutional medicine to the patient, so it starts healing its immunity, and the body's own immunity is trying to defend its own skin.
Okay. Okay.
Now the itching and the burning on the surface will be reduced. Then the scales and the flakes will be reduced, and then patient will feel like as if the skin maturity has been slowed down, and slowly patient will be better with the time. So cure is not something like disappearance of the symptom, but it's a gradual restoration of the health with disappearance of the symptom, along with less progression or less recurrence of the symptom. Right. So
So
this is what the theory.
what you're saying is that the psoriasis, the symptoms of psoriasis, is telling us that something else is wrong, that the immunity needs to be healed. We need to concentrate on making their own immunity much, much better, much healthier, more balanced, and then the skin starts to heal and not produce more flaky skin and more psoriasis symptoms. Will they have to keep taking the homeopathic medicine for years and years and years?
See, this varies with patient to patient, because if I have an emotional constitution, I may be prone to develop some other symptoms every time I get an emotional conflict.
Okay.
So at
So
those moments, I may need to continue the treatment for some longer time.
that's very interesting. Okay. So what you're saying is this person might be reacting emotionally to their environment, their life, their circumstances, to everything that's happened. And when they go through another emotional upset, it might trigger something different. But of course, by that time, I suppose we know so much more about them and we know what remedies are really going to work with their immunity.
True. So we are knowing what is his constitution is. So we'll be prescribing those medicine or the medicine which are in relation to this particular constitution, and then we are experiencing the less severity and less frequency of the disease if they suffer again. So
Oh,
likewise, patient will be slowly better.
yes. And so, of course, it means that the next year they might just need 1 or 2 doses, and the year after that, even less still. So slowly over time, their body is completely redeveloping and their emotional state is more stable, maybe.
Correct. So what usually we do is we prescribe them. We see the changes. We observe that patient is on the right track. He's getting better, and then we prescribe them the minimal doses of the medicine, and afterwards they're just acting like a booster dose only. So they will just boost their immunity, and he'll be fine in the next time whenever he suffers again.
Okay, that's really so. What I love about homeopathy is that our patients learn so much more about their own body, don't they?
True. See, but this is not being clearly understood by many of the patients, and many other, unfortunately, even conventional medicine prescribes something else. So we are here to treat them from the roots. So I believe that homeopathy has to be taken if they wish to get rid of the psoriasis completely, but they should keep some patience.
Yes, yeah, yes. Okay, so they should understand that we're not there to just take the symptom away. We're there to take the cause of the symptom and
Yeah,
change that, make them much more healthy, which of
true.
course they're going to notice, because psoriasis is such a difficult problem, isn't it? Because everybody can see it, and quite often we've got this emotion of them not wanting to be seen, or is something needing to be hidden. So we're looking at all of those things. Have you got an example you can give us of a case?
Yeah, I'll describe your case. Before that, just understand the core of the psoriasis. I just want my audience to be to know that psoriasis is an internal expression. So it is an internal guilt, internal suppression, internal anger, the outcast feeling, the refused feeling, the rejected feeling. So everything, it is like a volcano coming out. So when patient is not able to express it in some other way, so their skin is being expressing it. So it's like an erupting volcano, and that is psoriasis. So
Okay. S-
I hope it's easy. It's easy now.
Yeah, yeah. Now, a lot of my psoriasis cases are men. Do we see more men than women with psoriasis?
Uh, Usually, probably in India, women are more expressive compared to men.
Okay.
So that's why people the men are usually the more sufferers, because they keep suppressing the things.
They're not okay. And I find sometimes that it's quite difficult to find the emotion. So I obviously need special questions to be asking, okay, if you were suppressing an emotion, what emotion are you suppressing and why? I mean, would that help for them to speak more?
Usually, see, the common question that has to be asked to the patient is where you are not able to express your own self.
Okay.
Because
Okay. At
because
that time.
yeah. So there may be domination from some other one from the family. So there may be some comparison in the family or in the school or in the colleges or in the offices. So where they feel devalued, that is what we need to dig into.
Where they feel devalued, that is the most important point.
So that is the element where they feel ashamed of their own self. So they are not into their own skin, and that's why the skin is reacting. So
I
this is how this develops.
Okay, okay. We've got it now. We understanding what it is that we're actually looking for.
Right. So I like to narrate a case. Shall I?
Yes, please.
Okay. Lot of people usually say that psoriasis takes a longer time to get better. Psoriasis takes years to get better. See, I have seen many cases where when you hit the right core, the right element, the right cause of the conflict, so the patient reacts very quickly, and you'll find results in a very quicker phase period of time. So I have this guy, almost 32, 33. He was a friend, he was a brother of one of my friend. So he got referred to me. He was suffering from psoriasis from last 5 years almost, and it all started after his marriage. So I was knowing this guy. He was staying with the elder brother and his family, the elder brother's wife, his kid, and the patient himself. They were staying all together. So we have a concept of the joint family here in India. We like to stay together. So this guy, he was unmarried that time. He was living with the elder brother and the family. Everything was going good. Then he got married, and again his wife was staying with the family. So after introduction of a new person in the family, there were a lot of conflicts happening between his wife and the brother's wife. So the brothers, he was more attached to the brother's wife. She was like a sister to him, but because of the conflicts, his brother's wife told him to stay separately to avoid the conflicts and to avoid the clashes in the family. So he was very much embarrassed because of his wife. He had to live away from the family. So this was the embarrassment he felt. Then he felt like my all my richness is what? Richness is family. Richness is gaining people. So he was devoid of the people. He was devoid of his closed ones. So he felt homesick. You can call it. So a lot of time people call the changing place causes psoriasis. So this is the change of place, change of the comfort zone of that patient. So he had to stay away from his own house. Then he was much more dependent on this elder brother. So all that business got lost. So he was thinking as if there is no one to help him. He has been outcast because of his wife. So that was the guilt he had, and he repeatedly tried to come to brother's house, but the things were not the same as it was before. So slowly within a year span, after his marriage, after 6 months of the marriage, he started living separately, and after 6 months of the this separation, he developed skin lesions, and within a year it flared up like anything. So he developed an erythrodermic psoriasis. It is the worst part of psoriasis. Out of 4 or 5 major what do you call the types of psoriasis, erythrodermic psoriasis is the worst one. So
Okay.
there, the scales and flecks are huge. They huge because you can find the bulk of the flecks there when they remove their shirt or their trousers. So this was the worst case I have seen in last few years, and this was the whole scene. So according to this scene, I took some rubrics like element from embarrassment, the homesickness, the business loss of the poverty, diligent poverty. So this I have taken disgraced because everything was going good, and surprisingly, with the introduction of a new person in the house, everything was disgraced because his graceful life was deteriorated. So
Mhm.
disgrace. So according to these rubrics, I prescribed him sulfur 30 single dose. Yeah, sulfur 30 single dose, and within couple of weeks, there were all the frequency or the intensity of the itching and burning has significantly reduced. It was significantly reduced within 45 days. The flex were much more better. And within a couple of months, he was almost like a normal skin, though there were a lot of inflammatory patches there. But it took almost 6 months to get rid of them completely. Now he is with me from last 3 years, and there is no recurrence. His skin is like a normal one only. So this is what I want to tell, that if you hit the right core of the medicine, if you take a right constitutional medicine, and if you visit a homeopath with a detailed case history, rather than prescribing on the acute or symptoms, the symptomatic treatment, the therapeutic treatment, there are a lot of good medicines. So they are good at the acute phases of the disease. But
Yes.
when you wish to get rid from the roots, you must go to the element and the causation of the case. And surprisingly, within 6 months, he got better. So this is something that we usually do not see, but it happens. It happens.
Uh-huh. Uh-huh. It's really fascinating, because actually our clients need to understand, don't they, that we're not going to giving them something for the skin. We're going to be giving them something for that emotion that really caused this suppression. And so we really want to encourage our clients, don't we, to know and understand that we're going to be asking some really difficult questions.
Uh, they're not the difficult questions, but this is something that people do not dig into, and they want to be emotionally consoled somewhere. So it's better to ask them.
Yes, yeah, absolutely. Well, it's been absolutely fascinating learning this, because I struggle with psoriasis clients. I usually can get 50% better. And what you're saying, then you can see that 50% better in the first month, and then it might take 6 months to completely clear, and for the body to learn a new way to develop. So it's been very, very interesting for me. And I think a lot of people will be absolutely really excited about what you're saying and your experience of helping people. So if you wanted people to contact you and find out more, what is the one thing that you want them to take away from today, with the realization that actually this is something that you don't have to live with forevermore?
I will tell them that always believe that homeopathy does wonders. They
Yeah.
should visit homeopath at once, because see, being getting suffered for the life is not the good thing to do. So rather than trying many therapies, better come to a homeopath.
Okay. Okay. That's really interesting. And from the case that you explain to us, your prescription was very classical homeopathy. It was one dose, one remedy. And do you find usually that you don't need a whole array of remedies? It is one remedy that is going to be helping.
When you hit the right core, it is all done. So try to find out the exact core, and it is easy. Then
Yeah.
yeah, if things are not good enough, if patient want immediate relief, then of course therapeutic drugs are there. They can be introduced, but they can do some part of the case. But if it has to be treated from the roots, it requires a constitutional one.
Okay. Okay. Thank you so much, Dr. Nitin, for coming on and explaining this. And we're going to be obviously showing a lot of people a lot of different results than they've had in the past, just learning about how homeopathy can help. What we're going to do is put your links down below so that people can get hold of you directly, so that they can find out how to work with you and how to start on this big, big journey, because it really is life changing for a lot of people, isn't it?
Yeah, it's true.
Thank you
So
so much.
thank you so much for having me here, and thank you so much, Mary, for giving me this opportunity to explain this difficult case of psoriasis and psoriasis in total. Thank you.
Well, wasn't that fascinating? If you found this episode just enthralling and inspiring to actually do something, then you will find this very, very useful. Go and have a look and see what other resources that we have got that's going to help you on your homeopathic journey and get rid of psoriasis forever.